So welcome. I know we're going to see some attendees joining us. I want to thank, as our attendees roll in, that you are joining the CAP Behavioral Health Supplemental Training for youth and young adults. And I'm excited to see folks joining us because I know so many of you are young adults and/or you care deeply about the kids in our community. And this is all intended to make sure you have the resources you need to keep doing the great work you're doing in the community. I'll just remind folks that we're recording this, and we're recording it because we want to make it available to the public for folks who want to make sure that they have an opportunity to learn more about these amazing resources that we have available for all of you. So with that, I'm going to go ahead and get us started. So today we're going to be sharing behavioral health resources for youth and young adults. And this information, as we all know, is more important than ever just because of the stress of the pandemic and now students who were at home, now getting back to school and all of that we know is so important. I know people are exhausted and feeling isolated and frustrated and often anxious. And so it's also a good opportunity for us to make sure that we're checking in with each other. There are many reasons I know that you know to be hopeful, and there are a lot of tools that we can use to help us really to be in a space of more positive, more being able to move forward with our lives. And for sometimes we need more help than others. And you can understand that counseling and support and medications can be crucial at times and can make all the difference in the world. So before I turn it over to our experts, I just wanted to make a couple of observations. We know that this is also a really good opportunity for us to help people who need behavioral health services access them. And there are many people in our community who never thought they would need these services and who need them now. But the other is, you all know we've been fighting the stigma about mental health issues for generations. And this is another opportunity for us to help people understand that accessing services, that not only there's no shame in it, but there are lots of people doing it. And so this is really about making sure that people know that it's okay to ask for help, and we want to encourage it. Each of you will be equipped to better share these resources after our presentations today. And before I introduce our presenters for today, I'm really honored to introduce a very special guest and a longtime friend of mine, and that is Ronnie Lott. And many of you know him as a pro Hall of Famer or a 49er or a Raider, or just there are many ways we know Ronnie Lott. But I know Ronnie Lott as a champion for kids. And I so appreciate him being here with us today. And he's somebody that I respect a great deal. So I'm going to turn it over to you.
Well, thank you. Thank you very much. And thanks for having me. And, the thing about life sometimes is that you realize as you're trying to help, you recognize your own challenges. And I've had my moments where I've had to go and I've had to sit down and I've had to think about, how am I going to get my mental health together? And how am I going to change my outcome every day? And so one of the great things about playing in the National Football League is that when you play in the National Football League, you're going to lose. And you're going to have moments where you're out there by yourself. And there are going to be moments where you're going to have your worst play. And so for me, I know that as a defensive back, I got to have a short-term memory. And so how did I train my brain to do that? Well, it's like today. I'm going to learn a lot today on how to train my brain to make the right decisions. And one of the great things that you guys will all experience is get a chance to change your attitude, your thoughts, your ideas. And so be open to it. Be open to learning. And one of the great things, one of my teammates has really mental health issues. He's bipolar. He's had so many problems. And yet I've learned to love him. I've learned to get to understand who he is. I've learned to be able to go and just talk with him. I've been able to go to the doctor with him. I've been also there when he is at one of those moments where he said, hey, I'm going to do something really tough and crazy. And yet throughout that whole experience, I love him and I want to care for him. And that's why I wanted to show up today, because I wanted to show you guys that I'm vulnerable. I've had my problems. I've had my challenges, but I want to learn. And I want to make sure that my mental health is the best thing that I can be. Is the best thing that I can be. And all of us out there, we deserve that. Trust me, we deserve to have the best that we can be. So thank you for allowing me to come and spend some time with you. I hope that you get to learn a lot today. And I hope you have a woo moment. Woo! It's something about having woo moments. I love it. Thank you, guys.
Ronnie, thank you so much. And I really just want to emphasize two things that you said. I think one is that you're right. We've got to make mental health just a part of who we are. And as much as we focus on the health of our bodies and eating nutritiously, that really helping our minds be all that we can be. I love the way you said that. The other thing I just want to add, for those of you who don't know this, that, you know, Ronnie has dedicated a lot of his life to raising money and really helping young kids who are in challenged situations succeed. And the thing I wanted to say, in addition to thank you, is that I think, you know, being able to say, you know, that we've all needed help and it's okay to ask. That message that you have today is a message we really want to get out to folks, because I think that all of us, no matter what we've accomplished in our lives, we didn't do it by ourselves and we all needed help.
That's right. All the time. All the time. So thank you. And thank you for being my teammate. And thank you, as you well know, we've been in the huddle a lot of times together in so many different places. And I love when you quarterback me.
Well, thanks, Ronnie. And I'll just say that my husband and son will be so thrilled that you actually said that to me. So I'm pretty honored today. And we'll make sure, Ronnie, as we do more of these, that we invite you again and tell you how we did today.
Thank you.
Thank you. Thank you for all your love and love to your family.
Thank you. Be well. Bye-bye.
So I'm just really thrilled. He's just such a good friend. And I want to thank David Mineta, who's joining us for connecting, you know, Ronnie with all of us today. So we have some other, this is as far as I can take sports analogies. We have some other first string players here with us today. And then after that, I got nothing. And that is, I really am excited to introduce David Mineta, who's the CEO of Momentum for health, mental health. And one thing I wanted to say about David is these workshops were in large part inspired by his thinking. And I just want to say a very special thank you to him. Dr. Marianne Dewan, who's the County Superintendent of Schools and the leader of our County Office of Education, just somebody who over and over again, her leadership has just been impressive to watch and get to be a part of. And Zelia Faria Costa, the Director of Children, Youth, and Families System of Care for the County Behavioral Health Services System. I'm so excited that she's with us as well. And I want to thank David, Dr. Dewan, and Zelia for spending your Saturday afternoon with us. And thank all of you who've joined us. And just as a reminder, we're recording this so we can send it out to many more. So with that, I'm going to turn it over to David Mineta.
Thank you, Supervisor Chavez. And all, I just have to first. I just want to oh, Alex, could I just go back to the big script before we share the deck? Are you seeing this? I just want to thank Ronnie for coming out this morning. I had to bring my jersey in. You know, I'm 57 years old. I got a 49er jersey for the first time in my entire life. I've been going to games since I probably 10. But I got my jersey 2 years ago, and I got Ronnie's jersey. I didn't know I was going to actually ever meet him, and talk to him. But thank you, Supervisor Chavez. Thank you, Hall of Famer Ronnie Lott. I also want to thank Supervisor Chavez's staff, Paul Murphy and Alex Lynn, specifically for everything they've been doing to make these behavioral health trainings even possible. The three of them are quite a team, and very honored to be on this panel with Dr. Dewan again, and also Zelia, the Director of Children, Youth, and Family from the Behavioral Health Services Department. So thank you all for being here on such a beautiful Saturday afternoon, spring Saturday afternoon. But this training, as we've said, is so vital at this point. And I think we can start the deck. Alex, thank you. You know, as we've said, COVID has impacted our country's mental wellness and well-being, and has had a huge impact. The data nationally and locally highlight the effect. So today we're going to be talking about what is happening, how to respond as individuals and as a community, and where to connect for help, specifically as it relates to youth and young adults. Here's our agenda for today. Again, you know, with our experts today, and there'll be a lot of time to answer questions. People, if you have questions, please in the chat, feel free. And also, I think we'll have some interaction a little bit later. So again, our quick agenda, just general impacts of COVID-19 and protecting our behavioral health and wellness, particularly for youth and young adults, and then our behavioral health supports and services. And again, you know, with Dr. Dewan and Zelia, we have our county experts on where to go and connect for help. Next slide, please. So the impacts of COVID-19, you know, where can we go where COVID-19 has affected some part of our world or life? And, you know, it goes across all regions of the South Bay of our county. It goes across all demographics, income levels, education levels, everything. Although some communities have been impacted, you know, much greater than others. And particularly in behavioral health, we want to actually know, you know, what's happening and who it's happening to. Very early on in the pandemic, the federal government started collecting data that actually showed elevated levels of adverse mental health conditions, substance use, and suicidal ideation across the country. Back in June of 2020, the federal government through CDC and SAMHSA were reporting these elevated levels. They saw that the prevalence of symptoms of anxiety disorder was approximately 3 times those reported in the second quarter of 2019. This was for adults. And the prevalence of depressive disorder was approximately 4 times that reported in the second quarter of 2019. Again, suicidal ideation was increasing, and the CDC also reported that mental health conditions were disproportionately affecting specific populations. And I want to actually call attention to these just early on, specifically young adults, Latinx persons, African Americans, essential workers, unpaid caregivers for adults, and those receiving treatment for pre-existing psychiatric conditions. One thing that we also were, that the government was tracking, between April of 2020 and October of 2020, the proportion of children's mental health related emergency department visits among all pediatric ED visits increased and remained elevated from April through October. Compared with 2019, the proportion of mental health related visits for children aged 5 to 11 and 12 to 17 years increased approximately 24 and 31% between April and October of last year. So again, we can see that the impact of COVID is, you know, again, very real, and it's very real across the country, as well as here in Santa Clara County. Next slide, please. So I'm hopeful that many folks have actually seen some of the information that's been coming out around how to process stress and emotions in more positive and healthy ways. And I would say today, even the training, getting the information, as Ronnie was saying earlier, is helpful all by itself, right? Getting information, hopefully getting this information today will help you, and in some ways, we're hoping will relieve some stress. It is a stressful topic, but getting this information hopefully will relieve stress. Here on this slide are some other ways that experts have been recommending that all of us can actually process and deal with the stress and emotions of the pandemic, so many of them, in so many original stresses that we haven't seen in other, in the fires and in other things that we saw earlier. I mean, we saw last year, and we've seen during during the pandemic. So again, some are pretty, we get them, be around people who are positive, either by phone, Zoom, text, just even taking time to be aware how you're feeling. I hope all, as we get, more sunny weather, that we get a little bit more, bounce on our step again. I know I feel that way today, being here with all of you on such a sunny Saturday, spring day. But again, I think, self-nurture, we always say eating, physical activity, eating well, physical activity, getting your sleep. Again, all of these things are so important for our resiliency in the pandemic and beyond, right? So here are just some ways. Again, this is on the slide deck, and I hope that people have their own ways of healthy coping during the pandemic. Next slide, please. And Dr. Dewan, I think is, oh, I'm sorry, Zoli's up next.
Yes, good morning, everyone, and thank you for the invite for today to be sharing with you some information. So I really want to spend some time here on this slide going over how to access our behavioral health services locally. And I want to make sure that everyone is aware of what is available and how to access them. So listed here are a variety of different resources and numbers that are available to everyone. And I'll start by just pointing out that our suicide and crisis hotline, the number there, 1-885-278-4204, is a hotline that is available to everyone 24/7. And it's operated by our trained volunteer counselors, and we have 70 counselors that are available to take calls. The services are free and they're confidential, and anyone, again, can access those services. We also have our crisis support via text, and anyone can text renew to 741-741. And again, we have trained crisis counselors available to receive those texts and to respond and to connect folks locally if needed. We also have our mobile crisis response teams that are available to respond in person in the community to a variety of different situations. And these teams provide screening, triage, crisis assessment, intervention, de-escalation, crisis stabilization, and also referral to services. And sometimes people call in and just for information. But again, the key here is that these teams are available to respond in the community to any crisis that folks are experiencing. What is unique about the children and youth crisis team is that they also provide post-stabilization services for those who are in need, and those children and youth who meet the criteria can stay in the program for up to 3 months. So I just want to make sure that everyone is taking note of those numbers. So for our adult response team, the number is 800-704-0900. And for our children and youth services, which is a program operated by Uplift Family Services, the number is 408-379-9085. Then we have our numbers to access behavioral health services in general. And we have our call center number for folks who are in need of accessing mental health services. And the number is 800-704-0900. The call centers provide screening and referrals and information to folks who are in need of being connected to the services. The Gateway call center number is for substance use treatment services, and the number is 800-488-9919. And we have a dedicated referral coordinator who takes calls for substance use treatment services for youth. She is embedded in a specific treatment program and available during business hours, Monday through Friday, 9 to 6. And that number is 408-272-6518. After hours, calls can be made to the main Gateway number for substance use treatment services. I also wanted to point out that we have a couple of other additional resources that are listed here on this slide, and that is the County of Santa Clara Facebook Live. So during the pandemic, Public Health Department hosted a variety of different Facebook Live sessions, and they've invited behavioral health staff to make presentations during those sessions. So we do have a variety of those sessions on the Facebook Live page, and we had staff who went and spoke about resources and how to cope with stress with young children, with young adults. There was a session on substance use services. So those are all available on Facebook. The other resource that I wanted to point out, which is a really great resource, is the National Child Traumatic Network. And it is an excellent resource covering a variety of different topics related to childhood trauma. They cover topics like physical abuse, sexual abuse, traumatic grief. They also cover topics like bullying, community violence, disasters, including the pandemic. They provide tip sheets, resources, and an abundance of information. So I wanted to make sure that everyone is aware of these resources, because mental health is just so important, and no one should be dealing with mental health on their own if they don't have to. So please take note of these resources and these numbers and reach out to us. Next slide. Again, I wanted to really just emphasize and point out that for crisis situation with children and youth, please call the number for Uplift Family Services, 379-9085. Whether you're dealing with issues related to uncontrollable behaviors from a child, or you're worried about your child being a danger to themselves or to others, this is the number to call for an in-person response 24/7. Next slide. I believe that Dr. Guan.
Thank you so much, Zelia. Thank you, David, for this idea and for bringing us together. And my deep gratitude to Supervisor Chavez for her leadership and support and deep care and concern for community, and for this opportunity to share some additional resources. As many of you likely know, maybe experiencing even firsthand, that since the pandemic, a lot of the systems, the institutions, the ways in which families were able to navigate and receive resources and information that were dependent upon access to child care centers or school campuses and things that they were familiar with in community were disrupted, and a lot of the in-person offerings were just not possible. And yet we know that families have been experiencing isolation and having a lot of questions about how to manage with their children, maybe some of their children's behavioral reactions that are likely quite normal to the anxiety related to the pandemic, and maybe even children sensing the anxiety of their parents and others around them, and their routines and the like being disrupted. One of the services that the County Office of Education provides is the Inclusion Support Warm Line. We call it a warm line because it's not really suited for crises, but really is a place to get information and to be able to access a wide variety of resources. The Inclusion Support Warm Line is available to families, to parents, to caregivers, to educators and community members, and is really a resource that will provide positive behavior supports and information to parents. It also is an opportunity to get an initial informational screening and perhaps referral to other resources, agencies, services, and schools, resources and access to developmental screenings for children aged 1 month to 5.5 years old, and answers to questions regarding inclusive practices, parent and educator resources. In fact, the Inclusion Support Warm Line will help parents develop social stories, visual supports, other ways in which families might benefit from having resources in the home to help their children, as well as maybe linking those services into childcare or into the school setting. Transitions can be very difficult. We're going to be experiencing a lot of transition now as more and more families do choose to go back to school campuses for in-person instruction, and the Warm Line can assist with helping parents help their children be ready for those transitions. We also can provide technical assistance and support to increase the availability of inclusive services for children with disabilities. And while a lot of this inclusion support appears to be targeted towards individuals with disabilities, it's also just available to any parent who may have questions about their child's developmental development, their child's social needs, and the like. And lastly, during the pandemic, we have also been utilizing the Inclusion Support Warm Line as a resource coordination for referrals and recommendations around distance learning support and accessing digital resources for families in need. So if a family was really struggling or their child was struggling to get access to a computing device that they needed for learning, or a hotspot or otherwise internet connectivity, the Warm Line is available for that. The Warm Line is staffed by experts in education and parent engagement, and it is available in English, Spanish, Vietnamese, Mandarin, and Korean. Next slide. One of the big concerns that we have been seeing in our data and have been hearing about from community is concern about enrollment in the earlier grades and programs. So parents perhaps not being able to access preschool, perhaps choosing not to enroll their children in a transitional kindergarten, or first grade program out of uncertainty as to whether distance learning would work well for their child. We recently launched the Steps to Success initiative to help families understand about the importance of enrolling, attending, and benefiting from early learning programs. And this campaign is aimed at increasing enrollment and attendance in early learning because we know the significant benefit that that is provided by these programs as children are developing. And we also wanted to help ensure families that these programs are safe, they're equitable, inclusive, they're of high quality, and they have the tools that they need to be operating during COVID-19, so that families can be sure that if they choose a program or they choose to enroll, that their children would be safe. Next slide. A similar scenario is in place for childcare, and this has been a major source of anxiety for a lot of families. Finding childcare, being able to stay in childcare, knowing if childcare was going to be able to be operated safely during COVID-19, and just a lot of changes around employment status and the like. And we know that women in particular have been impacted in some very challenging ways due to the pandemic. So the Child Care Resource and Referral Program is a place in which families can find childcare. They can locate providers. Um, they can also access information and resources, receive training, and also get technical assistance. And these resources are available for both the parent and the family, as well as for the providers who are enrolled in the program. Families can visit the Child Care portal at childcarescc.org to find high quality, safe, licensed childcare for all ages. And if families are in need of assistance with finding a provider and navigating this tool online is not beneficial, we also do have a phone number. And the phone number is 669-212-5437. And again, it's 669-212-KIDS. Next slide. A lot of the questions that can also be it's challenging to navigate and to have different phone numbers and different links for different programs. So we've organized all of these resources under one initial web page to make it easier for families, pediatricians, and others to help refer families into services. And you can find all that information at enrollsantaclara.org. Next slide. Another question that we have been receiving in our crisis hotline and our informational lines here at the County Office of Education is about how services are available and what is open and available to in-person, and in particular in some of the hardest hit areas of the community. So I wanted to share about the Community Health Partnership and our school-based health clinics that are providing in-person services throughout Santa Clara County. And many of these provide behavioral health and access to behavioral health and mental health and wellness services, in addition to the physical health, wellness checks, and other services. Additionally, the Community Health Partnership does provide information in a number of languages. And I just want to point out, for example, that the languages listed here on the screen, that many of the clinics can serve families who prefer to access their services in Spanish, Vietnamese, Japanese, Korean, and Mandarin. Next slide. In the spirit of wellness and self-care, it's also vitally important that we support our community with resources to address their physical, emotional, and/or mental health and well-being. And we want to ensure our community, students, educators, parents, caregivers, and our partners in the medical community about the resources, tools, and support that is available. Distance learning has been challenging for some families, and so a great starting point for getting access to services and information related to distance learning is available at our SCCOE Learning Resource Portal. This is a one-stop shop for students, parents, administration, and staff to find helpful information and resources, including teaching tools and activities, childcare resources, and more. And this portal is also a really vital resource because we want to be mindful of not having all of our learning and all of our children's time be online. And so there are a lot of recommendations about outdoor activities and other types of hands-on learning experiences that families can utilize at home. Additionally, the Department of Healthcare Services administers the Medicaid and Medi-Cal Specialty Mental Health Services Program. And if a parent believes that their child or they themselves need specialty mental health treatment services, they can call the toll-free phone number and ask for an appointment for an initial assessment. And lastly, on this slide, I wanted to mention California's Mental Health Movement Resource Center. Walk in Our Shoes is a youth mental health program, and it provides resources for educators, parents, and young people. And there's also a Walk in Our Shoes campaign and classroom facilitation guide and activities that help familiarize students and young people with mental health and wellness. Next slide. In partnership with the county, we've been just recognizing that our families are experiencing stress. And again, a lot of the stress is what we might expect while we're dealing with all of the anxiety around a global pandemic. And there are some resources just to help families cope with stress. We've been helping to disseminate these 2 flyers. The first about coping with stress that is targeted at the general public. And then the second one is coping with stress while taking care of children. And additional resources are also available on our website. Next slide. Even prior to the pandemic, mental health was, or youth mental health was becoming at a crisis level. The suicide rate for young people aged 10 to 14 years had doubled between 2007 and 2014. And during this past 12 months or so, we've seen in our data that 1 in 5 California high school students considered suicide in the last 12 months. And there's also been a 227% increase in calls to the California Youth Crisis Hotline during the pandemic. So we know that there are some very serious levels of crisis and concern in our community. And we know that the return to in-person instruction on campuses is going to be beneficial and helpful, but it will also perhaps signify change in routine, and may also accelerate or exacerbate some of the crises that children are experiencing. So we wanted to make sure to share today some of the crisis hotlines. The first is the 24-hour suicide prevention lifeline phone number, and the California Mental Health Services Authority 24-hour number. You'll notice that the number is the same, and also that there is a feature to text to that. And then the California Parent and Youth Helpline, which is very targeted at the specific needs of young people, and you can call, text, or live chat at that number, 855-427-2736. So in the spirit of community, it's just imperative that we take care of each other, recognize that there is need all around us, that everyone has something that they are dealing with or managing, and to lend a supportive hand to those in need, and encourage everyone to help get the word out, to share these resources, to share them with others. Thank you. And I think we're back to Zelia.
If I could, this is Cindy. I want to just see, before we go into a kind of a deeper dive into the behavioral health services that we offer, I wanted to see if there were some questions that we could respond to. I know people have been doing a really good job of answering answering questions, but just wanted to make sure we were able to answer any questions that folks had that right now. And if it starts to bleed over into what we're going to do next, we'll hold those off. The last part of this agenda really is to look at kind of taking a deeper dive into the county services that are provided. So let me just see if there are any questions that where folks want to raise their hand or anything that hasn't been addressed in the chat that that David, you or others would like to respond to? I don't see any raised. I do see one. Victor, do you want to?
Yes, Supervisor. Hi, Arthur. I sent you a request to unmute. Please do accept the unmute and then go ahead and ask your question.
Yes, I'd like to know whether whether we should proactively identify people who have mental or behavioral health issues by screening everybody who has everybody who, whether they have an issue or not, in our when they have a doctor's visit.
Thank you. David, do you want to take that?
Yeah, thank you. And thank you, Arthur. I know in the chat, it's a little difficult to elaborate on, but it was a great question. And I think that as Dr. Dewan said, that there was some discussion even before the pandemic on child and adolescent screening, behavioral health screening, when folks were going in for their primary care visit. I know I'm on the Provider Advisory Council for the Santa Clara Family Health Plan. They have, a large carrier for folks in the public insurance system, and they had already sent out to their pediatricians that recommendation, and there was a screen, a quick screen, and a lot of this is a result of the childhood traumatic assessment study that the Kaiser Foundation had done. And so that we're still, and that was years ago, and we're still, the system is still moving towards that behavioral health screen. So to your point, though, but I think that and I've talked with, and I'm sure Supervisor Chavez has done the same, and is leading on this, is Santa Clara Family Health Plan they are even working further now on trying to get that out to the pediatricians for those visits, and also their medical groups at large.
And David, Kathleen King is on the line too, and I'm going to let Kathleen chime in because Kathleen's doing some great work with kids that I think, Arthur, really speaks to what you're talking about. So Kathleen, can we unmute Kathleen? Good. There you go, Kathleen.
Thank you. I actually had a question, but I will say that I'm on the Santa Clara Family Health Plan Board, and one of the efforts we have is screening fifth graders. We had a pilot this year, and it was very concerning because about 42% of the kids showed some kind of borderline need, and we're following through on that. And we hope to be bold and screen fifth graders in 6 districts. I know that's not maybe what you want to hear, but it's a start, because once you have data at that level, you have ways of, I think, being more persuasive. So wish us luck. And we're counting on David Mineta and the Behavioral Health Contractors Association to help us heavily on once we find the kids that need it. And we're actually finding parents are very willing right now to work with the providers, more willing than we even expected. So,
which I think, Arthur, is the good news. I mean, I think it's becoming more accepted, and we do screenings like that now, particularly around domestic violence. And so there's precedent. So thank you for that thought, and we'll learn more and continue to collaborate with our partners. Kathleen, go ahead with your question.
David, this might be a question more for the adult session, so I apologize if I'm asking too soon, but so many of our staff work with the children that have these needs, and we started a mandatory mindfulness every day at a certain time. But any recommendations you have on that might be good for the nonprofit organizations, that if you know a program's already developed, we kind of start it from scratch, but
No, thank you. Yep, yep. You know, and Kathleen, number one, I mean, thank you. I mean, I appreciate you. So we're so lucky that you're here today. And Cindy's so sharp to be able to say, you know, to ask for your help on that last question. On this question, I have to say, it's sort of ironic. Momentum, we have a wellness program that we're doing sort of similar to what I think you just said that you have in place. It's a mindfulness program. They're meeting right now, but I need to be at this training. So, and I can't wait to find out what they're doing. I'll find out tomorrow. But you know, I think it's really, really important to highlight that even CDC was showing that the caregivers, right, are being impacted. Their mental wellness is being impacted by the stresses, all the stresses of the pandemic, and the caregivers, the providers. So that's been a concern among the behavioral health provider contractors association, as we ramp up and prepare for what we believe to be the tidal wave of new cases coming in, and great people coming in for help. That's what we want. We want to make sure that our staff themselves are in a good place. So one thing that we've been suggesting for folks is, again, looking at engaging with the EAP, right? Engaging with our EAP programs, engaging with our insurance carriers around behavioral health counseling sessions. We're asking the staff to also look at their time off because of the increased need of referrals and all coming on the adult side right now. A lot of our staff haven't felt like they could really take time off. We're asking them actually to take their time off, both direct service staff, mid-level managers, and our executives, because this is a marathon. And if folks aren't getting their rest as we move along, we're worried about the condition of the providers in about, probably a couple of weeks. I don't know, tomorrow, Monday. So, I think it's a great point. And I have to say, we're in it right now, trying to figure it out as well. And I'd love to hear other people if any other suggestions. I know I've heard at Supervisor Chavez, the Women's Leadership Conference last week, I was on listening to something on self-care, and it occurred to me, one of the presenters was talking about, she spends a lot of time watching YouTube videos, and I thought that's what I'm doing right now. I watch all of Ronnie Lott's old highlights, and so anyway, but I really am open to other suggestions. Supervisor Chavez, if you have a good one for self-care.
Well, I think, one thing I do think that I think there's this really great opportunity, and Kathleen, let's make sure we add that to the agenda as we're talking about adults. But I think that there's this really great window of opportunity, that there's a lot that's been wrong about COVID-19. So let me just start there. But one of the things that I do think that that I said earlier is that I think, because so many of us are experiencing the same thing, that being able to ask for help and thinking about how behavioral and mental health impacts workplaces, school sites, faith institutions, that this is the opportunity we have to normalize that behavioral health and mental health are as significant as physical health, and that it's okay to ask for help, and that we want to make sure that medical insurance and is robust and covers all of those bodies of care. But let's talk more about that. We got one other question in the chat that I just want to make sure that I'm acknowledging, and that is there a way for the county to consolidate these phone numbers into a simpler format so it's easier for outreach efforts and for communities that may have disabilities to remember? And the short answer to that is yes, and we're working on it. You're completely right that we really need to get to one phone number with a very quick assessment that can get people to the right places. And we've been thinking a lot about how to do that, and we'll give it more thought, but my goal is to attach that to some action in the near future. So with that, I think the next presenter was really going to be focused on the supports and services that the county has. And so I'm going to turn this back, I think, over. Zelia, am I giving this back to you?
Yes,
Okay, great. Thank you.
thank you, Supervisor Chavez. So next slide, please. All right, here we go. So I'm really going to be talking about all the different services that we provide to children and youth through our county behavioral health services. But I just wanted to start out by sharing with you what the vision and the mission of the department is. So I'm going to just read this slide off here. So our vision is the public behavioral health system is successful in helping to ensure that all residents in need of public behavioral health services are physically and emotionally healthy and happy and thriving. They are in a safe and permanent living situation. They are part of a loving and supportive social network. They are involved in meaningful school and work activities, and they are safe from harm from the environment and others. Our mission is to really assist individuals in our community affected by mental illness and serious emotional disturbance to achieve their hopes, their dreams, their quality of life goals. To accomplish this, the services must be delivered in the least restrictive, non-stigmatizing, most accessible environment within a coordinated system of community and self-care, respectful of a person's family and loved ones, language, culture, ethnicity, gender, and sexual identity. Next slide, please. So this slide illustrates the comprehensive continuum of care for children, youth, and transitional age youth and families. It lists all the different programs available from the least intensive to the most intensive level of care. And when I speak about level of care, I'm talking about it's related to really the number of service hours provided to youth, to children, youth, and families in these programs. The services are provided by trained professionals and paraprofessionals, and also by licensed clinicians in several languages, and they can include individual therapy, family therapy, group therapy, and medication management if it's needed. And of course, we address a variety of different issues, from anxiety to depression to behavioral health issues, to developmental concerns, trauma, and more serious issues like schizophrenia and other types of mental health, mental illnesses. So you will see that this first box here illustrates and lists our prevention and early intervention programs. And these are programs that offer up to 4 hours of service a month, working with children, youth, and their families, supporting them in treatment, again, to address behavioral issues, psychosocial, emotional concerns. And the services are typically provided in a variety of different settings that can be either school-based, home-based, community-based, or clinic-based, really depending on the preferences of the family. So I'm just going to point out a couple of the different programs, because I'm not going to go over every single program that we offer, but we do offer our schooling services, behavioral health services at school sites. So that means that we have clinicians who are actually school-based at the schools, reaching out and providing the services on site to families and to children and youth. Let's see, I'm also going to point out our Raising Early Awareness and Creating Hope program, because I think that's a really important program that provides outreach and intervention for children and youth who are at risk or are experiencing early signs of psychosis. And they provide those services in a team approach with a variety of different professionals who are involved in the care of the youth, from clinicians to occupational therapists. The Substance Use Prevention Services is a program that really is available countywide, not just to children and youth, but also to adults. But for the children and youth, this program is really very important because it provides psychoeducation, and it provides a whole array of different activities for youth to be involved in. For example, we have a culinary academy program, as well as what we call our YTI program, which is the Youth Technology Incubator. They teach youth how to use technology. And when youth are involved in those activities, they're also getting psychoeducation around substance use prevention. The next level of care that's listed here are our outpatient programs, and they represent a higher level of care by which children and youth can receive up to 7 hours of services depending on their needs. And these programs address mental health issues, substance use issues, as well as co-occurring issues, which means that for those youth who have both a mental health concern and a substance use concern, we have programs that address the co-occurring concerns. Again, the services are provided both by our community contracted providers as well as our county operated clinics. And we offer a whole array of different programs. Some of them are population specific. So we have our ethnic specific services. We have our LGBTQ programming. We have our transition age youth program. This particular program is operated by a county clinic, and they serve youth from the ages of 16 to 25. Again, it's a team approach. We have psychiatry, we have clinicians, therapists, we have a community worker, peer support worker, and really the intent is to wrap our youth in the services that they need to ensure wellness and recovery. I wanted to also point out our Kid Connections Network and our KidScope Developmental Behavioral Pediatric program, because this program really focuses on our birth to 5 population. And it's just such an important population to target services to, because really can be preventive works early on to prevent people from getting deeper into the system as they continue to grow and be challenged by different situations. So this program provides screening, assessment, and treatment. We work with a multidisciplinary team where we have occupational therapists and speech therapists. We have our developmental pediatric specialists and our clinicians. And again, they do assessment for intervention and also deeper assessments for more targeted diagnostic issues. Moving along the continuum, our intensive programs are the next higher level of care, and they provide services up to 14 hours a month. And these services are targeted for those who meet more significant diagnostic criteria and are experiencing significant challenge and need more support. And here we have, you'll see that there's some of these programs are color coded. And what that means is that for those youth who are referred to us or are child welfare and juvenile justice involved, you'll see that they're color coded in purple. Youth who are involved in child welfare services or with the child welfare system are color coded in blue. And then our youth who are justice involved are color coded here. The programs are color coded in green. So I wanted to call out the transformation team, which is a program that provides intensive services to youth who have been commercially sexually exploited. And this is a team approach where we work with child welfare and juvenile probation, providing these services. We have advocates, clinicians, and it really is a very important program, as we've seen an increase in the number of youth who have been referred to this program. Our probation gang resistance and intervention program is also a critical program that works with youth who are at risk or have been involved with gangs. And again, that's a team approach and a community-based program that provides a higher level of care. And we also have programs that serve youth who are, for example, are in juvenile hall. That's our Guadalupe Behavioral Health Services, as well as the program that serves youth who are at the ranch. That's our Youth Therapeutic Integrated Program. So that's a co-occurring program that addresses both mental health issues as well as substance use treatment concerns. And then next on the slide here is our intensive wraparound and other intensive programs. So those are full service partnership programs and wraparound services. The intent here is really to wrap the youth and the family in all the services that they need to do whatever it takes to ensure that they're on a path to wellness and recovery. These programs really serve our most complex, high-need children and youth. And then the last box that you'll see on the slide here is our residential program. So we have our short-term residential therapeutic program where children and youth can stay up to 6 months. And again, these are for most complex high-need youth. And the substance use residential treatment program, youth can stay up to 30 days to receive substance use treatment services. Of course, you know, the family is always involved, and we want the family involved in all of these services, because without family involvement, we really cannot support the youth in the recovery that they need. And then at the bottom, you'll see in the light blue, we have our therapeutic behavioral services. And this particular program can be accessed by any youth who need targeted interventions for behavior. So this is an adjunct program, which means that it will be an adjunct to any of the other programs that a child or a youth are involved in. And then right below that is the crisis services, can also be accessed by anyone in this continuum of care. And we do have several programs within this continuum of crisis services, which includes our mobile crisis program, as well as our community transition program. The community transition program is a really great program that provides intensive services when youth are transitioning. For example, youth who have been hospitalized due to a serious mental illness, and they're transitioning back home. This program will provide supports to the youth and the family for that transition to be successful. And then, of course, we have our crisis stabilization unit that really supports youth who are in need of what we call a 5150. So when youth are a danger to themselves or to others, they can go to the crisis stabilization unit for support and stabilization. Next slide. So here we have a new program that was developed during the pandemic, and it's called the Virtual U. And So Virtual U is a virtual wellness center providing engagement, psychoeducation, and wellness activities for youth and young adults ages 12 to 25. Some examples of the activities that are being offered this month, for example, are mindfulness groups, self-care through artistic expression. They have game nights. They provide the youth tech incubator that I was referring to earlier. That is a program under our substance use prevention services. And this month, that particular program is giving voice to stories of women and girls, creating like photo, audio, and video projects. They also provide virtual yoga and a space for youth to just come and talk. The activities through Virtual U can be accessed by emailing Youth Wellness Center, and there's the email right there, or by calling the number 408-961-4700. Next slide. So during the pandemic, we really have had to adapt our services to be able to be responsive and flexible to the community. So the services have been really provided by a hybrid approach of both telehealth and in-person services. And we have shortened sessions because I think somebody was referencing this earlier due to just like Zoom fatigue and, just being online and accessing all these different services virtually. We have seen that as well during sessions. So our clinicians have really tried to keep families and youth engaged by shortening the sessions, but providing more frequent sessions. They've also been holding sessions outside, whether it be at the park or even in people's backyards. And our clinicians have also put together therapeutic care packages for youth to keep them engaged in their therapeutic journey. So they've delivered some care packages to youth that include things, for example, journals for them to write in, or stress balls, or just even crayons and paper for them to be able to artistically express themselves, again, contributing to their therapeutic journey. And then finally, I would like to just leave you with some strategies on coping with stress and challenges, whether they be for yourself or to share with others. And they're listed here on the slide, but really, I think instilling hope is just so important, and doing that at every opportunity that we have, because hope really underpins the recovery process of mental illness. And we just have to remind ourselves and others that things, will get better. Also tapping into natural resources and relationships of those around you, whether they be your family, a friend, a teacher, just someone you trust, is really so important. And also keeping to a routine and having structure and a schedule can be very helpful in giving us a sense of normalcy. Spending time with family and friends while observing safety guidelines. And now that people are getting vaccinated, and I'm sure everyone is just so hopeful that we can start hugging our loved ones again. Talking about concerns with others, sharing your thoughts can be a big relief, knowing that you're not alone, and asking for help when you need it. And then regulating yourself by slowing down, even just in breathing and just being. And then paying attention to your thoughts and how they can drive your emotions and your behaviors. Thoughts can have a very significant impact on one's wellness. And then last but not least, just spending time, again, meditating and being. And I will leave it at that. And I'm not sure who comes after. Here we go.
So it's going to be me, and we're going to get to some questions, and we actually have quite a lot of questions. So I'm going to start with just a couple that are in the chat. And one is, are these resources available for all children or only children with Medi-Cal?
These programs, with the exception of a few programs, the majority of the programs that I did describe are available for children with Medi-Cal.
And is there an easy way for people to know which is which, or do they have to call and find out?
I wouldn't be able to say right off the top of my head right now which are which, but I think calling our behavioral health call center, they will be able to point folks in the right direction to the programs that can be accessed that are not Medi-Cal related. I know for sure our prevention and early intervention program at the schools can be available for people who are do not have Medi-Cal insurance.
Great, thank you. And COVID, the second one is, COVID has become an unexpected enabler to previously concerning behaviors like obsessive gaming, excessive screen time. Are there resources for and suggestions to parents that are in a deadlock between safe isolation and unhealthy levels of addictive behavior? David, is this you?
Only because we work on this at home with our 16-year-old. Yeah, I mean, I think that Lance, that was a great question. I think it's a tough question though, because as we've seen across COVID and across the pandemic, there are situations and areas that we, the issues that we were having pre-pandemic. So for in this case on screen addictions and all, I mean, I think we were still trying to get, trying to figure out some, helpful solutions and all. Since the pandemic, and because of reliance on screen time for both education and socially and all, as you said, I think now we see this increase in problems across many different age groups as well as adults actually. So I think this is one of those points out, like across our pandemic response, there are so many other areas that we're going to need additional help in. I unfortunately don't know. I don't know if Marianne or if Zelia have, other resources to point to on this.
I would offer, just as an introductory place, the inclusion warm line. This is one of those areas of specialty that our team would have around ways in which parents can help children adjust their schedule to develop some transition planning out of this time at home back into more in-person instruction, and how to monitor their children's behavior to get a sense of those reactions, because I think some of the addiction or addictive type behaviors, we're not recognizing those as addiction right now. We're looking at them as those ways to stay busy during isolation or to stay connected. But once that time away from the screen or the cell phone or the learning device occurs, it may show up as some anxiety in children or some other behavior. So really helping parents be on the lookout for that and to plan for it. And then just additionally, there have been a lot of articles recently that have been emphasizing the outdoors as a really healing opportunity, and to provide some time for that type of step away from the screen time. And so really encouraging the use of outdoors, and including that about 2 hours a week or so of being outdoors can have a significant benefit to these kinds of unhealthy practices.
Thank you. I'm going to see if there are any folks who want to ask questions about, I know we gave you a lot of information and really appreciate all of you hanging in with us. Are there any questions that folks want to make sure they put them, you can put them in the chat or you can put them in the Q&A or just raise your hand and we'll get right to you. No? All right, it looks like we got to most of the big questions. And just as a reminder, we'll send out the slides to everyone. And in addition to that, we'll send out a recording of this session. I know for me, sometimes it's better if I can hear something more than once, you know, to be able to kind of better understand or just to even digest what I've learned. And I really, really appreciate the ideas that people have given us, both about how we make this more user-friendly and what we can do to create not 100 phone numbers, but one. And we really are looking at all of that. And I see Zelia nodding her head because, you know, in some ways, just as a wrap up, one of the comments I'll make is that Santa Clara County and our community is unique in terms of the amount of mental health services that are provided in our community and through the partnership between the behavioral health contractors, the County Office of Education. And part of the reason for that is that of the resources that we get in the county to spend on behavioral health services, almost 80% of them we spend through our contract partners. And the second thing I would say is we're one of the few counties in the country that use our general fund as robustly as we do to provide support to these kinds of programs. Many counties, you know, they spend more of that money on roads and on other kind of infrastructure. And by the way, this was done long before I got on the board. This was really under the leadership of Supervisors Jim Bell and Blanca Alvarado, and before them, you know, Zoe Lofgren and Rod Dearden. So for those of you who are closer to my age, you'll know those names. For those of you who are younger, just know we had some good leaders leading the way. So thanks for that. I really want to say a very special thank you to David Mineta for your just genius and helping us pull all of our pulling us all together and really helping us stay in touch with the mental health issues. I think they're going to continue, and we'll continue to do these kind of meetups so that people can learn more about resources. I want to thank Dr. Marianne Dewan. We're so proud of the partnership we have here with the Santa Clara County Office of Education. Marianne, I don't know where we'd be without you. Literally, I don't know. And Zelia, thank you so much. You know, our behavioral health services department, they've got a ridiculously hard job, and they have been very you know, growing frankly in leaps and bounds. And the part of the reason you see so many phone numbers is every time there's a new program, we're just trying to stand it up as quickly as possible. So I think one of the things that we recognize is we've got to get all those integrated, and Zelia and the folks who work in our behavioral health services department, they are, I don't know, they're just the cream of the crop. Very, very blessed to have all of you working with us in Santa Clara County. So to all of you who came and spent some of your Saturday afternoon with us, thank you. We'll get this video out to you. Please feel free to send it out to people who you think it will help, and we'll make sure that we continue to do these kinds of gatherings if they're helpful to you. So let me see, after the training, they'll send a follow-up email with to all registrants, PowerPoint slides, the recording of the session. And if you have any questions, you can reach out to Paul Murphy in my office, and his email is in the chat. All right, thanks all. Have a great rest of your Saturday.